Welcome back to Showcase Pittsburgh on KDKA-TV. I'm John Klein. Today, 6 businesses stopping by, including USA Insulation, Allstate, and New Image Hair Clinic. But right now, Dr. Ian Bulow from Revive Upper Cervical Chiropractic is back on the show. Good to see you again, Doc.
Thanks so much.
Let's start at the beginning in case there's
Sure.
somebody watching today, because you always have some interesting information. What is upper cervical chiropractic?
Sure. So upper cervical care, it is a specialty within the field of chiropractic. Just like in medicine, you have doctors that specialize in different areas of the body. Within chiropractic, there are doctors that focus on different areas of the spine. And upper cervical care focuses primarily at the point where the head and neck meet one another. It's a very delicate area. You know, you have all this range of motion that allows you to see the world, but at the same time, when you're in an injury, it's usually the first area that becomes damaged. And because of how close it is to your brain, what we're finding is that upper cervical misalignments can actually affect our brain function and how clearly we think and how we stand and our balance and really important issues. So we choose to start and specialize in the upper neck because it's one of the most common areas that's an issue for most people, and it can have the greatest impact in their overall health.
As we've talked before, you've pointed out that it really controls everything from motor skills to hearing to seeing to
absolutely
everything.
Yeah, when we see patients that have issues in their upper cervical spine, the soft tissue that holds it together has been damaged in an injury or an accident, the symptoms can vary because of the brain is such an integrated part of the body. It controls everything. So first and foremost, very often we'll see headaches, you know, maybe some dizziness or balance issues, numbness in the fingers in the morning, of course neck and shoulder pain, maybe even an acid reflux or an irritable bowel, you know, those sorts of things.
All of that's controlled through
absolutely
something that could be misaligned in your neck.
Absolutely. In fact, the centers for control of your heart and your breathing are located in the part of your brain right at the base of the skull. So heart rate variability issues, digestive issues, immune issues, all the way to the chronic autoimmunes and chronic fatigues and fibromyalgias and the heavier disorders can have their roots in an unstable brainstem and an unstable upper cervical spine.
Can a lot of the things that you just mentioned be corrected or controlled through what you do then?
We see it clinically very often that yes, it can. My opinion and what I tell the community and what I tell my patients is that I'm not here to say that upper cervical care is a cure for all these different things. What I am saying though is it's a starting place for anyone that's serious about getting well. A lot of therapies and medications and things we may need, and they definitely help us manage a crisis or a symptom, but to get back to fully functioning, we have to get back to the brain, which is the ultimate boss of the function of the body.
Do you find that the majority of us probably have had some sort of damage or a head jar or something as we go through life, maybe as a little kid, and we don't even realize that that is affecting us as adults?
It's a great point that you bring out, and I would say that a lot of people, kind of like high blood pressure or high cholesterol or issues along those lines, have some pressure in the spine and may not even know it. So it's our recommendation that everyone get checked throughout life, whether or not they have those headache type symptoms or not. I've been checking my kids from the day they're born. Now it just so happens that they haven't had colic or ear infections or bedwetting or any of those issues. I don't find it's a coincidence. I think that if we do monitor these things, just like if someone monitors their blood pressure, they're gonna have a better outcome over the course of their life.
Let's talk about with school coming up, and there will be some injuries. And the first thing I think of football, whether it's you know, little kids, big kids, anywhere in between. And there are a lot of neck injuries and head injuries, or even just getting banged around in a game. Do you have advice for parents who have a son or daughter who maybe they're playing lacrosse or whatever?
Absolutely.
And there's some issue that might come up in the fall that they need to look at.
Absolutely. The research shows that there are certain sports that are more likely to cause a concussion or a whiplash injury than others. And as much as I love football, that's one of the top ones. Yeah. So if your child is in football, but even in soccer, we've had volleyball patients. I have a patient with post-concussion that plays volleyball, and that's the volleyball pole came down on her head, and she had all kind of concussion issues. Ice skating, figure skating, people that fall and hit the head. A little bit of everything. Yeah. What it takes is typically a blow to the head and neck that can cause either a whiplash injury or a concussion. And what happens with most patients, the ones that I see, is they've been to doctors, they've been to specialists, but no one has taken the time to really look at the junction between the head and the neck, because it's not commonly aware of the influence that has in brain function. So it's our opinion that parents should really watch out for these injuries, and no matter if the symptom occurs on the field or in the first week, or no symptoms at all, they should be monitoring these things to make sure there's no problems.
Just watch pay attention to your kids.
Absolutely. The symptoms could be, maybe a headache, maybe a dizziness, confusion. They don't have to black out. That's a kind of a misnomer. If you think of what the brain does for you, it controls your thinking. So what might happen with a child is they might be a little bit confused. They might stutter. They might forget what day it is or where they're located. That kind of mental...
Something that seems innocent, but it might not be.
Absolutely.
Right.
Attitude changes. If the child is irritable after the injury, if they're having trouble falling to sleep, if they're kind of moody and depressed, if they have a headache, these are all signs and symptoms that something happened in that child's brain that is causing some inflammation and some trouble. And of course, we need to see different doctors and therapists, but what I would like for the community to be aware of is they need to look at the upper cervical spine. Because no matter if they hit the head in the front, the side, the back, if they had a blow to the neck, the junction is such a delicate area that soft tissue can become stretched and can leave the child in an abnormal position.
Does the body heal itself, or is this something that you would need to address?
The body
Will it just go away?
Oh no, not typically on its own. The body always has the ability to heal, but it can heal incorrectly. If I break my arm, it will heal. But if I put it in a cast, it will heal correctly. Right? So it's our opinion that if somebody has a misalignment here, the soft tissue will heal. But it's a lot better if we correct it early on so it can heal accurately than needing to reset it later, like resetting a broken bone. But make no mistake, in our office, in our clinic, we expect our patients to heal and to stabilize and to be symptom-free within a reasonable amount of time. We're getting to the underlying cause. We're not treating and therapeutically trying to cover up the symptoms. We want them to be stable underneath, but we expect them to reach that stability in a reasonable amount of time, for sure.
Doctor, are you surprised at some of the results that you've seen?
Well, I used to be. Honestly, I used to be. But anymore, it's just something that we expect. The body's designed to function a certain way, and when we reconnect the brain with the body that it's supposed to control, we expect improvements over a reasonable amount of time.
Get some improvements. Thank you, Dr. Bulow. If you'd like to know more about Revive Upper Cervical Chiropractic, call Dr. Bulow 724-772-7060 or log on to revivepittsburgh.com. Mike Madden from USA Insulation, he's on the way next when Showcase Pittsburgh continues.